Friday night as an opportunity for everybody to reflect on why they're going out and why they came here. Maybe it was to raise funding, maybe it was to raise awareness, maybe it was to meet other people, but one of the cool things about a hike and being out in nature is that it really gives us the opportunity to reflect. And I just ask everyone to take a minute tonight as you're going to sleep or in the morning when you're getting up and you're heading out on the trail, even if you're just going on the short hike, or if you're volunteering and you're just walking back to your cabin. Think about why you're here and why you're hiking and why you came to this event. So anyway, in the second year we started a tradition where we asked somebody who is a Histio warrior or a family member to just spend a few minutes and tell us why they hike, and Stephanie has been gracious enough to be our speaker this year, so I'm going to invite Stephanie up. As she mentioned earlier, this is her third hike. So with that, Miss Stephanie. Do you want to go through or do you want to?
I wrote it down, so I'm professional.
Right into the mic.
Okay. Is that better? Is that good? Really close. Right here. Okay. Hi everyone. My name is Stephanie Brownell. I'm 22 years old and I'm an HLH survivor. I was born January 29th. I was born January 29th, 1992. I have a sister who's 3.5 years older than me. And when I was 9 months old, so in October of 1992, I was diagnosed with an ear infection and started antibiotics. I had a full body rash and a fever up to 105, and the doctors attributed this to an adverse reaction to the antibiotics. And after switching the antibiotics, the hives and the fever continued. They never stopped. My mom kept taking me to the doctor with no final diagnosis. The working diagnoses were an allergic reaction, Kawasaki's, juvenile rheumatoid arthritis, and rheumatic fever. I was admitted to 2 hospitals for a fever of unknown origin, hives, and a heart murmur that I developed. And once the doctors realized that they couldn't diagnose the disease, they stopped looking for answers. 7 weeks after the first symptoms, I was admitted to Johns Hopkins Hospital, and Dr. Peter Rowe, a diagnostic pediatrician, admitted me to the hospital and assured my parents that I would not be discharged without a diagnosis. And the team of doctors it took to diagnose me was a cardiologist, a dermatologist, an infectious disease specialist, a rheumatologist, a hematologist, and an oncologist. So it took 5 days to diagnose me with HLH, hemophagocytic lymphohistiocytosis. And the doctors told my parents, we wish we had good news that we could tell you, and we wish that we could tell you it was leukemia, because we know how to treat that. We know of some chemotherapies to treat HLH, but it never works. It just slows the progression of the disease. They explained that there's a genetic form and a viral-induced form, and they could not determine which form of the disease I had because in 1992 there were no genetic tests available. They explained that HLH was always fatal, but they were going to try a combination of chemotherapy drugs. My treatment was IV etoposide, or VP16, dexamethasone, and methotrexate injected into my spinal fluid. And the doctors informed my parents that when the first chemotherapy drug stopped working, they would use a different chemotherapy, and the last resort was a bone marrow transplant. But that was considered experimental at the time. In the meantime, I had become comatose, and treatment was started that day. Within 3 days, I was sitting up again and trying to eat. I stayed in the hospital for 1 week undergoing treatment and had a Berviac line inserted since, at the time, I was too small for a porta-cap. After release from the hospital, I was only admitted one other time for sepsis, which was 2 days after my initial release from the hospital, and I've not been hospitalized since. I underwent outpatient chemotherapy for 10 months, traveling from my home in Virginia to Johns Hopkins Hospital in Baltimore, which is a 2-hour trip one way. I was declared in remission of March 1993 with no active histiocytes in my spinal fluid when I was 14 months old, but continued to undergo treatment until October of 1993. The doctors were concerned that I would have severe learning disabilities, but the only side effect I had was a severe speech delay. So I took speech therapy for 3 years, which is why I can speak today. I still have annual blood work to check for latent effects of the chemotherapy, which can include leukemia. And I'm still in remission, and I'm considered cured. I graduated from James Madison University in May 2013 with a Bachelor's of Science in Public Health Education, and I'm currently in school at Shenandoah University getting my Bachelor's of Science in Nursing, and I'm graduating in December. My love of medicine stemmed from all of my time spent in hospitals and doctor's offices and my mother's nursing career. I'm grateful to medicine and my parents for pushing the limit in their continued search for answers. They refused to give up until I was diagnosed and began treatment. In the pre-internet days, they existed, my parents felt very alone and confused because the only information about HLH was in medical school libraries. Each article began with, HLH is a fatal form of histiocytosis, and there is no known cure. My mother found a reference to the Histiocytosis Association in an article, contacted them via snail mail, and was connected to a network of parents. They received a list of other HLH and LCH patients and their children, so they didn't feel as isolated. I'm grateful that I do not remember the disease process or the treatment, but this does not mean that I don't remember that HLH is part of my past. My body wears scars of HLH in my treatment, but I bear them proudly. I incorporate my past into my interactions with patients every time I'm in the hospital. I have an increased empathy for patients, and it shows through my practice. I'm here to hike to raise awareness. I hike for those lost to this disease. Sorry, I'm emotional. I hike for those lost to this disease and for my own past. I'd like to make a statement now into awareness. I raise money for the future of the Histiocytosis Association and for every child that is diagnosed and treated so they can have a success story like mine. I hike for a cure. My name's Stephanie Brownell, and I'm a Histio warrior.